Good evening, Mr. Pravin.
Thank you so
He's
much.
with us today and he's Head of Talent, DVP of Tata AIG, Head of Talent Acquisition. I hope, Mr. Rai, I got it right.
Yeah, thank you
Thank you
so much
so
for
much
the
for your
invite.
time, for giving us the time. I'm Dr. Paula Goel, pediatrician, adolescent specialist, and lifestyle medicine expert, and from Faith Clinic. So, Mr. Rai, what would you give us your take on chronic diseases in the corporate sector?
See, as we
Understand
done
the
a,
chronic diseases in the corporate sector?
see, if you, we as the corporate, we do a lot of surveys, and recently when we did a survey, the most of the symptoms which people are going through is basically, the work pressure. Because we participated basically in Great Place to Work as well, and as a part of health survey, we found that the work pressure, the time which is beyond the expected from an employee to perform, it has linked to various various related to something related to stress disease, which also affected their the lifestyle. So when I say lifestyle, basically, they doesn't able to work balance, between their personal life and the professional life, which is also a part of one of the symptoms where their families are getting disturbed because they don't give a time to their family. That's one thing which is majority of the things as a come out as a work environment for us to work out. Secondly, people are associated with a lot of using alcohol and tobacco. That's another second things which came out, that people have started becoming that addiction of using alcohol, tobacco, and other chewing habits. Apart from this, the third thing which it also gave highlighted that because of the stress level, the blood pressure, plus the symptoms of diabetic. This also has come out very broadly. Coming compared to the percentage of the last 2 years prior data which we have seen. So this three are something which is a very important factor for us. As a Tata AIG to look at from an employee health perspective.
Yes. And also, I would add, along with this, you should also add dyslipidemia. Dyslipidemia is one of the most hidden diseases.
Okay,
So
that's
generally, diabetes gets checked and blood pressure gets checked, but lipids most of the time is not checked. And
okay.
we must understand that the Indian coronaries, the heart vessels, are very small in size, 6 to
Yeah,
5 to 6 mm, as compared to the Caucasian, which is about 12 to 13 mm. Almost 50% reduction in size of the coronaries. So that itself is a major problem. In addition to this, we spend large amounts of time on gadgets. So cervical spondylosis, neck problems, trigger thumb, trigger fingers, anxiety, depression, panic attacks, cancer, body image, all these are also part of the circle and they all add up to the stress of the individuals. I mean, you're from the corporate sector, you know looking good is important in the corporate sector.
that's true. So, as you rightly said, ma'am, so what we done is that recently, based on the survey, we are launching a new policy which is about 35 years and age and above. There are packages which we have tied up with our FHPL because they are the association for a lot of insurance for us managing our medical claims. So basically, it's a small where they will go undergo for every 6 months. They will go for a checkup program, and they will submit a report to us so that we are aware how their health is going on. Plus, also at certain age, we are also planning to see if we are hiring senior leadership level, where is about 40 years about to see that the previous medical history, because earlier that was a trend a decade as a process note that HR used to have a pre-medical checkup used to happen for corporate,
Yes.
but over a period of time this has been diluted. But now as an organization again we are looking at especially whether we need to look at the age of 35 years and above or maybe 40 years where we need to go for a pre-medical checkups. So these are certain initiatives we are planning to do because there is a cost involved. So we are seeing how the our trends in terms of at a senior level of hiring what we are doing right now. how we can see this can make us a conscious decision apart from the assessment what we do. So these are
Right.
the things which we are looking at to a proactive measures for as a part of our good hiring strategy. And secondly,
Yes.
I mean, as we are associated with you, so this year, every quarter, we are planning to, have such programs for our employee, which can create an awareness, because awareness is something which is very important. And because as we are in corporate, we don't get time to focus on our own health. Now, if we start keeping such health initiatives and awareness program, that will push to an employee to at least go and do a checkup and see what is the best thing which we can work out.
Yes, definitely. And let me also tell you that we see very young people with heart attacks and strokes, late 20s and 30s, heart attacks, early 30s. And the process of it starts very early, maybe in the adolescent years, maybe in their 20s. So, does your company have any policy, or what is your uptake on the health of the young adults? By young adults, I mean less than 30 years of age. So,
Uh,
they look healthy, but are they really healthy?
See, this is a question which started since the pandemic started, because we have seen a lot of turnaround happen in the last 2 years.
Yes.
But as you rightly said earlier, as a practice, we used to have a lot of camps across pan India, which we used to do through FXPL. It was just an initiative of putting at least one camp in a year. But in the last 2 years, as HR, we were having a major, challenge for us to manage an engagement, and connect with an employee. Now,
Mm.
every quarter when we do an employee connect, and the major themes which came around was about work pressure, and we have seen little attrition as well. I mean, people have started at writing, because of the work pressure, because it is because the initial first year, due to pandemic, we were having expectations, so we were little lenient. But after that, when the market started opening, so naturally the expectations were a little high, and because and that was another factor, that people uh, used to work in a professional workplace, but as people started working from home, so balancing out at the home, especially for female colleagues, balancing their personal life, balancing their professional lives becomes difficult. Secondly, people started working at an ad hoc time till 11:30, 12. That was an expectation. It became, as we are operating 5 days working, but it became 6 to 7 days, operational, course of action. So during that, when we initiated a little, a survey, which we rolled it out, and then we started getting a lot of feedback. Then every quarter we started checking out. Then it became a principle that let us come out with a data point. So when we observed on the data point, we found, as I mentioned, the first 3 points, in terms of, the stress levels, the personal life, balance. And then people got addicted to certain, this tobacco and alcohol. When people started putting, their frequency has gone up. Third is about the diabetic, and because of the stress level. Another, as you rightly said, as you come from a doctor fraternity background, so uh, people, when we started, doing counseling with them, then we came to know a lot of inputs, and based on that, as a company, we decided that every quarter let us fix up, certain camps, and let us focus in the initial first 9 months, so that employee becomes healthy. So now that, as now it is again, the market is open. Now we started operating, but now still we are on the roster plan. But there are certain initiatives we are taking where the people have started coming to office. So now we have started, putting up physical camps. Also, people who are working from home, especially at a very junior level, we started, giving them an additional benefits of certain medical camps where it's a free of cost because of Tata Group. We have a
Mm.
lot of tie-ups. So within the Tata Group, they can go and at least do a basic health checkup, so that at least they come to know, as you rightly said, about the lipid profile. Most of us doesn't do, in more in detailing to understand where our health is of as of now today. So we are, started creating, but yeah, as rightly said, there is a cost involved. So we are, working out by age factor, because we have started creating with the seniority, with the age. These are the two factors we are trying to see, and what people are having currently, the symptoms which they are going. So major our objective is that let us focus that particular key segment, and then we can work out around the policies.
Yeah, because from what we understand that actually it starts off, all these disease processes start off early, very
Yeah,
early, maybe in their youth group itself.
yeah,
And the human body starts aging after 25. That's the
yeah.
point. One point which I wanted to ask.
Yeah.
What is it that your company or you all are looking at the health of the youth? Because the youth forms the base of the adult life. So anybody who's young, less than 30, if they're having hidden health issues, you're into insurance sector. So do you see in that, because all those will manifest out in their mid 30s and later, पर प्रॉब्लम तो पहले चालू होती है.
मैम
So
ऐसा नहीं है
any take on
एक्चुअली.
that?
एक्चुअली देखिए, प्रॉब्लम ऐसा नहीं आया हमारे पास एज अ कॉर्पोरेट, बिकॉज वी डोंट हैव सच regular health checkup program for our employees. In maybe 3 years or 4 years back, most of the corporate used to do a pre-employment checkup. तो थोड़ा बहुत हमें पता रहता था. और senior leadership में there was a periodic 1 year of the health checkup program is there. People who are earning more than 35-40 lakhs. Okay, so we used to give them a health checkup voucher, which was there, and they used to do it. Now, as I said, in the last 2 years, because of the pandemic, when we started chatting and when we started connecting with an employee, because there was no point of connect, because when you are in the office, we do a lot of engagement and a lot of connect programs, and we know where they are stand, and and a lot of initiative of physical connects are there. So when we say physical connects, we do a lot of group chat, group focus group discussion, which happens. And when people share their feedback and how they want to create an engagement program. And also with when you look at from a from a health perspective, because as I said, we are in the insurance. So the TPA, which is FHLPL, I mean, they come up with a lot of health related initiatives, and they do a lot of free of cost health programs for Tata AIG General Insurance. But in the last 2 years, when HR started connecting, and during joining and during exit process, or maybe through we had a connect program of 30, 60, 90 days, the first initial days. Now, what had happened is that during the interaction, when we saw a lot of disturbance in terms of their personal life, which is hampering their performance because they're not able to balance. Then a lot of attrition started happening from a from a female HR colleague, because they're saying that because the work timing is beyond the official timings, people are being expected to work by 10:30, 11. Even the the management trainee who joins us as a part of a management training program, even their Saturdays is also been taken care in terms of the working hours has been beyond like 10 to 11 hours they are doing it. So they are not ready to accept the work environment cultures. When this started triggering, and we've seen some few losses because of the COVID, and because of certain as you rightly said today, the age factor is totally changed, because the young people started getting a lot of disease symptoms and all that, and we seen certain facts and data started coming up, because we started paying the insurance to their family members. So उस pandemic में we created a document called health risk assessment, that is called HRA in short form, which we call it. We rolled out that program where we touched each every an aspect, और उसके ऊपर हमारा एक कुछ about 6 to 7 data points आए, जिसपे we started working, and it is linked with your age factor. So अगर as an organization, when I look at there are 8 factors. One is the diabetic wellness management, which came for us to work out. Second was the BP and stress management. Third was a cholesterol management, and the fourth was women wellness management. Then smoking and alcohol management, sleep management, vision care, and dental care. So these are the 8 aspects for us, which came for us to work out, with a health company, where we can create a program, and where we can create a various health initiatives, for different employees. As you rightly said, 35 years in age and above, we created a plan right now. so that at least they can go for a basic health checkup, and we can at least they can work out wherever they can work out on that. I can share you that
Correct.
the proposed plan from the corporate perspective. I'll share that two slides with you. I'll send you the pics.
Yeah, yeah. And also, off record, I would also tell you that the entire spectrum of diseases have come younger. So if you want, we can sort of make a basic screening sort of a questionnaire which you can run it through your team. You don't have to do any tests. If you do a screening, no, it helps just as a this thing, family history, work history, social history. So
So
it
what
also
we
gives
done?
it gives you a predictive value, and that
Yes,
predictive value allows you to understand ki what is
yeah.
the incidence of that individual getting any of these diseases, maybe in their mid 30s. But you
That is
need to
true, but yeah, but we didn't target actually as an audience, because then people become a little conscious. I mean, they hesitate in declaring themselves. They feel
yeah, for
that,
insurance they hesitate
yeah,
in
they feel
terms of
hesitant
declaring.
because they also feel that if HR is asking such, openness, if you put it a very open, upfront question to them, they feel that my job is on a stake at this stage of time. Because health check कर रहा है तो कहीं मेरी job चली जा सकती है. Because what it happens that when they apply
Actually,
for a
that's a very
medical,
wrong notion because they will catch hold of their disease and become healthier and work more and better,
नहीं आपकी बात सही है
ideally.
मैं या आपकी बात सही है but we have even observed that the female colleagues, I mean when we hire, we cannot directly ask them that are you planning for any family planning or something like that, but unfortunately what we have seen that people don't declare it. And
Mm.
unfortunately when they get on a onboarding after 3 months, because you have a 3 months of notice period, after they joining they declare us that they are pregnant. And for us, it's
Oh.
like if we are pregnant, naturally they will go off for maternity leave for 6 months. Again, I have to hire another person. So most of the cases are also popping out. People are not declaring. Secondly, the people now that it's very compulsory for us to do video, conferencing. Other earlier we used to like close through telephonic conversation all the interview process. But
Mm.
today people have a disability also, they don't declare.
Mm.
So things are getting up because these 2 years के pandemic में काफी on and off में we have little lightened up the process, but because of that we are getting an impact on it. So what we done is that through Microsoft Team we created a form which was very
Mm.
generic, health assessment, which was like a typically like a very generic people to give an answer. Based on that report, we give it to our assessment center, and they created the report. The how we do it in terms of our personal assessments. और बिहेवियर असेसमेंट हम जैसे करते हैं बड़ा जेनरिक और गेमिफाइंग टाइप के क्वेश्चंस क्रिएट करते हैं, उनको पता नहीं चलता है कि हम क्या पूछना चाह रहे हैं, बट बेस्ड ऑन दैट व्हाट nature they put an answer to it, then we take out an assessment ki what are the symptoms they are coming.
Mm.
So I'll
So,
share you that
and
format also ki
yeah,
how we have asked the HRA the forms which was been put up on the form, and what is the the proposed health and wellness program which we wanted to do, and what are the touch point for us. I'll share with you that point.
definitely. And any last message which you would like to share
Nothing. I mean, for us is that employee
of you as an individual or to anybody who is there? What message you would like to share on health?
see, as a corporate, employee is an asset to an organization, and employees are in an investment to for any organization which they are part of, as a part of a growth. The important factor for an employee is to balance his or her personal life along with a professional life. Both has to get balanced. But today's generation is something that they are not able to balance. They wanted more flexibility on their personal life compared to a professional life. So people have started, wanted a very cool, organization where they get a lot of freedom to do it. They don't stick within, organization. So today, if you look at any organization, especially in BFSI, 0 to 1, 0 to 1 year, the attrition rate is very high.
Mm.
So, as an organization, today we are also working, to create, because if you look at the Generation Z, which is like, people who are born after 2000, their work environment culture and their expectation is little, different. They need a very cool and flexibility workplace, along with their they don't want any interference in their personal life. That's the way the generations are going. And today, as an organization, this pandemic has actually opened up a lot of corporates that today we can give that flexibility that people should not come to office and they can, operate from home. But unfortunately, operating from home also had impacted their, most of the personal life. And in Tata AIG, we see most of the people, due to their personal life, एक ऐसा situation आ गया कि divorce तक की situation चली गई. People have got
Yeah,
disturbed.
that occurred a lot in the pandemic situation. But
Yeah,
yes, it is very heartening to know that as a VP, like you all are so much doing for the health of your employees, and I'm sure the employees will understand that.
yeah,
Because it is very important to how much ever we say, and why I am happy because I've been a spokesperson of this for so many years. Last 10 years, I've been talking about youth health and teenage health, youth health, and all the lifestyle diseases. But wo kya hai, when doctors say nobody listens. That's why I thought
that's
ki if
true.
I connect with people and if it comes from speakers in their departments, that's when people actually take cognizance of the fact that yes, it occurs and we need to take care of our health. And the earlier we take care, the better. It's like you start early and you have a longer race to, you can go comfortably. But you don't take care and the things strap up, crop up, it becomes terrible. You get heart attacks in late 20s and early 30s. It's dangerous.
That's true.
So I think that's all. This is a good message which should go out to all.